pain in young people is common, but did you know it could be autoimmune? Hi, I am Dr. Sri Anusha Matam, consultant rheumatologist at Pranushre Rheumatology Clinic, Bangalore. What is spondyloarthritis? Spondyloarthritis is inflammation of spine and sacroiliac joints. It can be associated with psoriasis, inflammatory bowel disease. It can be an undifferentiated spondyloarthritis, reactive arthritis. It is often misdiagnosed as mechanical back pain or gym-related injury. So what are the symptoms you should watch for in this spondyloarthritis? One is alternating buttock pain, the pain at night which wakes you up in the morning, very severe morning stiffness, especially in the mornings and after periods of rest which last more than 30 minutes and it eases with activity, and the chronic low back ache which is seen in young adults less than 45 years old, along with other associated symptoms like eye inflammation, which is called uveitis, skin issues called psoriasis. You can have inflammatory bowel disease like chronic diarrhea with blood in stools, and enthesitis like heel pain in the morning or Achilles tendon pains, and dactylitis like your total toe or a digit is swollen. Who is at risk for this spondyloarthritis? It is mostly seen in young men. It is also seen in women who are between 20 and 40 years age group, who have a family history of autoimmune conditions. HLA-B27 is a gene which is associated with spondyloarthritis, but this gene is not always seen. And if you have a recent chronic infections like diarrhea and upper respiratory infections. How is it diagnosed? It is diagnosed with clinical features, imaging, and some lab tests. So what are the lab tests we do? We do HLA-B27, which is a blood test, some inflammatory markers like ESR, CRP. We look at the blood counts, CBC, and your liver function and kidney function test. An MRI of sacroiliac joints is essential to find the early damage which is done to the joints, as X-rays can't detect it early in its stage. Early detection is crucial to prevent the spinal damage. So are there any treatment options available for this spondyloarthritis? Yes. We start with NSAIDs, which are painkillers, which are given to relieve pain and inflammation in the early stages. Some people get better with this. If they are not responding to these painkillers, the next option is DMARDs, which is disease-modifying anti-rheumatic agents like methotrexate, sulfasalazine, etc. And then biologicals, which are injectables like TNF inhibitors and interleukin-17 inhibitors for persistent and severe disease to prevent the damage. Along with these medications, you also need exercise and lifestyle changes to maintain a proper posture and flexibility. Swimming can help. There is no cure, but early diagnosis and treatment can keep the disease in control. So what are the few key points in spondyloarthritis? Back pain that improves with rest is mechanical back pain. Back pain which improves with exercise is spondyloarthritis. So any back pain, don't neglect. See a rheumatologist nearby for early diagnosis and treatment. Share this video to someone you know in your family, relatives or friends who has such a condition and symptoms. If you are looking for a specialist who treats such conditions in a nearby place, please see the description below.